Hello everyone, welcome to join our Symposium, Social Media Platform and Stigma, Discrimination and Misinformation Concerning COVID-19. My name is Ying Xu. I'm Associate Professor at Department of Sociology in Shenzhen University. I serve as the chair of this section. Now let me introduce our presenters. Please just give me 1 minute to share the PowerPoint with you.
The first presenter is Dr. Joseph Roy Gills. He is Associate Professor and Vice President of University and External Affairs in University of Toronto. Roy will present a paper entitled A Qualitative Analysis of Twitter Postings Focused on the SARS-CoV-2 Virus. Our second presenter is Dr. Roula. She is Assistant Professor at Family Studies and Human Development in Brescia University College at Western University. Roula will present a paper entitled Sequential Focus Group Approaches to Examining Experiences of Stigma and Discrimination. Dr. Abby Goldstein is our third presenter. Dr. Goldstein is an associate professor and associate chair of applied psychology and human development in University of Toronto. Abby will present a paper Motivational Interviewing, Enhancing COVID-19 Disease Prevention Through Behavioral Science. Dr. Ishtiaq Ahmed, who is an assistant professor at Department of Computer Science in University of Toronto, will present a paper entitled Stigma and Prejudice Against Asian Canadians and Asian Americans as Reflected in Twitter Posting. Last but not least, our discussant is Dr. Carmen Logie. He is a Canada researcher in global health equity and social justice with marginalized populations, and an associate professor at the Factoring Montage Faculty of Social Work in University of Toronto.
Hello, and welcome to our presentation of our symposium. My presentation is entitled A Qualitative Analysis of Twitter Postings Focused on the SARS-CoV-2 Virus. And this, of course, is part of the International Congress of Psychology 2021. And it is done virtually over Zoom. And my name is Dr. Joseph Roy Gillis, and I am a faculty member, associate professor at the University of Toronto. Welcome all. So first off, I'd like to acknowledge our funder for the research, which is the Canadian Institutes of Health Research from the Canadian government. The project title is Responding to the Stigma, Fear, Discrimination, and Misinformation related to the COVID-19 disease outbreak, a novel analysis and intervention for a novel coronavirus. And as I mentioned, it's funded by an operating grant, specifically Canadian 2019 Novel Coronavirus Rapid Research Funding Opportunity. The grant funding number is 720-591-51. And I am Joseph Roy Gillis, who's the principal investigators. I'd like to acknowledge my co-principal investigators, all of whom will be participating in this symposium today in one role or another. First up is Dr. Ishtiaq Ahmed of the University of Toronto, Dr. Abby Goldstein, also of the University of Toronto, Dr. Roula Kteily-Hawa, also of the University of Toronto, Dr. Roula Kteily-Hawa is actually at Brescia College University, Dr. Carmen Logie of the University of Toronto, and Dr. Ying Xu of Xinjiang University in China. Dr. Carmen Logie will be serving as our discussant for the symposium today, and Dr. Xu will be is the chair of the symposium today. So this is, of course, part of a much larger project, and we have outlined it as consisting largely of 4 stages, which are overlapping, yet contributing to each other in a sequential manner. So the data presented today will be largely from stage 1. Dr. Abby Goldstein's presentations will speak to some developments which we propose for stage 4 of the project. And various other presenters will be commenting on different aspects, either stage 1 or stage 3 in terms of the overall analysis. So to focus on what we'll be presenting today, stage 1 looks at the tracking and analysis of social media posts on Twitter, which contain misleading, stigmatizing, or fear-inducing messages about COVID-19. So let me review our abstract for you in case you have not had the chance to read it yet. So the abstract for this presentation is a qualitative analysis of Twitter postings focused on the SARS-CoV-2 virus. Background: the context of the COVID-19 pandemic has increased expressions of stigma, discrimination, and racism against people of East Asian descent, particularly individuals perceived to have Chinese heritage. These negative social media messages have had tangible outcomes for these individuals, including an increase in microaggressions, threats to safety, and verbal and physical assaults. Our methodology: from a total of over 600 million tweets gathered from Twitter repositories, such as those at Harvard University and the University of California at Santa Barbara, we randomly selected a total of 4,000 tweets to analyze based on a search of 62 COVID-19 hashtags judged to exemplify COVID-19 stigma. These 4,000 tweets were then systematically analyzed using thematic coding by pairs of raters to identify emergent themes. We replicated the content analysis conducted by Lai et al. 2020 based on their model of stigma communication, which found that peril, mark, responsibility, and group labeling were the contents of the tweets most frequently associated with COVID-19 stigma communications. Our results: like Li et al. 2020, we found substantial evidence for tweets that express both group labeling and responsibility, such as the following phrases identified, which talked about the Chinese virus, about bad eating Chinese, about China as a terrorist country, an admonishment to the Chinese people to stop eating vermin, and a description of Chinese citizens as worse than primitive, another example of mainland China that caused the outbreak. In addition, we found examples of the communication of peril in such phrases as people are dropping like flies in Wuhan, out of control, dead bodies everywhere, and this is real gates of hell stuff. So I'm sure you agree with me that these are extremely disturbing, stigmatizing, and damaging messages to communicate about any group over social media. Conclusion: social media platforms are a venue for the widespread dissemination of stigma and misinformation for infectious diseases. These messages have the potential to intensify negative stereotypes and discrimination against targeted groups and to derail attempts by public health officials to create appropriate responses to COVID-19 and the reduction of stigma associated with that virus. So the background. During the COVID-19 pandemic, there's a great deal of evidence found to have increased stigma, discrimination, and racism against people, particularly of East Asian descent. More recently, many other groups have been included, particularly African, Black, Caribbean individuals and people from those sort of backgrounds and countries. And this has been documented in news reports and surveys and by community-based agencies. Harmful messages are especially prevalent on social media platforms, and that's some of what we're going to talk about today and expose in our analysis and further communications and writings in this research. Finally, these messages can result in increased microaggressions, threats to safety, and verbal and physical assaults, which have also been very much documented in the literature and in news reports and by community-based agencies. So rather than something that's hypothetical, it has already become a reality. So this picture here shows a recent protest march, or at least fairly recent, in March 2021 in Montreal, Quebec, Canada, against anti-Asian hate crimes, as inspired by stigma and discrimination posted on social media posting. So we can see that there is a response of the general public, and particularly of people from the affected communities, as you can see from the photo, to these events and anti-Asian hate crimes, which hopefully will result in government action and further research and further interventions to reduce anti-Asian hate crimes, as well as further actions by social media organizations like Twitter or Facebook to remove these harmful and damaging messages on social media. So, as I mentioned, this is a report by Statistics Canada, which has documented in survey form that visible minorities were more than 3 times likely, that is 18%, than the rest of the population, which was only 6%, to perceive increases in the frequency of harassment or attacks based on their race, ethnicity, or skin color. And this has occurred since the start of the COVID-19 pandemic, although we're not able to directly attribute it in a cause and effect sort of manner, but it is important correlational and epidemiological research on this topic. So my second photo that I want to show you today is at the other end of the spectrum, again in Montreal, Quebec, Canada, this time in September 12, 2020, where we have an anti-mask protest in the city. And here we have a number of people holding up signs such as oxygen is essential, promoting conspiracy theories, promoting the belief that the virus was created by Chinese government, or that the virus is a great hoax perpetrated on people to reduce their personal liberties, and very other widespread conspiracy theories that have become very popular on certain internet sites. So a review of our methodology: 600 million tweets, as I had mentioned, were gathered from database repositories. We randomly selected 4,000 tweets based on a search of 62 hashtags promoting COVID-19 related stigma, and the tweets were analyzed using thematic coding to identify emergent themes. So here are some of the themes that we've identified so far. And as I mentioned in our abstract, these are consistent with the findings of Lai et al. 2020. So stigmatizing tweets against Chinese individuals and communities, which involved Labeling using negative terms such as disgusting, barbaric, and evil were common, as were imposing cultural stereotypes regarding eating habits and the treatment of animals, blaming the Chinese people and the government for the spread of COVID-19, and promoting anti-Asian sentiment racism through stigmatizing hashtags, e.g. Chinazi or Kung Flu, which of course, former President of the United States, Donald Trump, was quite infamous for promoting on his Twitter accounts and in his messages to the US public and his supporters. Other related themes we found were strong negative political opinions that were voiced against the Chinese government through COVID-19 hashtags, as well as the spreading of misinformation, rumor, and conspiracy theories related to COVID-19, particularly about the spread and origin of the virus. Some examples of some of the very disturbing tweets, and perhaps this deserves a trigger warning of sorts for people before we read or look at these. So these are exact quotes of some of the tweets, with some of the more offensive words sort of start out. First one being, Chinese people must stop eating snakes, dogs, cats, rats, and all the other S*** food. The world will be, you can fill in that word, because of you. Second tweet example. Can't you not see how dehumanizing and toxic the communist government of China is? From human rights violations during the Hong Kong protests to spreading the coronavirus globally. And that's an example of where we see linkage of the criticisms of the Chinese Communist Party in governing China and linkage to spreading of the coronavirus. Finally, military web portal finally confirms that Wuhan coronavirus is an artificial virus. So again, a belief that this virus was intentionally spread by the research laboratory located in Wuhan, China, not some sort of perhaps accidental release, but an intentional act of worldwide sabotage. So our conclusions. Social media platforms are a venue for the widespread dissemination of stigma and misinformation for infectious diseases. Those harmful messages can have consequences. In fact, they worsen stereotyping and discrimination against targeted groups. They can derail education for the public regarding prevention measures and disrupt public health policies related to the COVID-19 pandemic. So here are some of our references, which you may find of interest and which were fundamental to some of our positions that we took and research that we conducted to date. I also would be extremely remiss if I did not thank extremely much our project director for the grant. Her name is Heather Abella, and she was instrumental in creating these slides. I also need to acknowledge that our senior project consultant, communications specialist, Lisa Chinchemi, was also intimately involved in the research and the creation of the slide deck, and contributed to many aspects of the research. In addition to all the many students who participated in the research, both undergraduate and graduate, really too many to list in a short 10-minute presentation, but you have my thanks, and you will certainly appear in future publications and presentations of this grant. So now I would like to be open to questions and any comments or any other clarifications that I can give about the research or talk about future directions of it. Thank you so much for listening to our presentation or symposium today, and we hope to be able to connect with you individually and perhaps network amongst those who have similar research interests. Again, thank you so much.
Hello, everyone. My name is Roula. I'm an assistant professor in family studies and human development at Brescia University College at the University of Western Ontario in London, Ontario, Canada. I'm honored and thrilled to be presenting at the International Congress of Psychology. And thank you for joining us for our symposium. The title of my segment for the symposium is Using Sequential Focus Group Approach to Examine Experiences of Stigma and Discrimination in Vulnerable Populations. So here's a brief outline of my presentation. So this segment in the symposium describes a novel use of sequential focus groups as an approach to examine experiences that relate to stigma and discrimination in vulnerable populations. And it's important to note that in my title, I used vulnerable populations, for instance, as opposed to disadvantaged or marginalized, that seem to be also common terms. And the reason for that is I would like to problematize those terms in relation to racialized people. Those terms in particular may show a deficit perspective. They may show that the participants involved are not able to engage in agency and change. However, those terms do carry with it an importance in terms of the reduced opportunities that impede access to resources, particularly for racialized communities. And when we look at those particular terms, marginalized and disadvantaged, we often refer to the material constraints under which many racialized families live and to the structural conditions that marginalize people from educational, economic, and political opportunities that might enhance their health, their social status, and community well-being. So again, in terms of my presentation, I'll start you off with an explanation of this particular methodology, which is the sequential focus group discussion. So mostly as a series of semi-structured interviews. Then I will relate it to the notion of a collective narrative, why this particular method of data collection is important in terms of gathering and capturing that collective narrative and voice. I will go very briefly into the theoretical underpinning of this methodological technique for data collection. I will look into an analytical model as well that would explain this particular method. And very briefly, I would consider two possible applications for the method. One, something that was used, and another one, which is what we're proposing, particularly for the COVID-19 stigma reduction. And at the very end, I'm just going to highlight the significance of the focus group discussion, the sequential focus group discussion in terms of gathering information around potential interventions. And again, in our case, would be interventions to combat stigma as a result of COVID-19. So what is a sequential focus group approach? So sequential focus group approach was developed and implemented in Canada as part of Educating for Equity, E4E. And it's an international research collaboration involving teams in Canada, took place 2010 to 2016, New Zealand and Australia, that explores how health professional education, particularly in Indigenous populations, can reduce disparities in chronic disease. And we define the sequential focus group as a series of semi-structured interviews with a consistent small group of people coming together to gain deep insight into a topic by exploring questions about an issue with each other. And typically there would be a facilitator that would oversee those particular focus groups and over an established period of time. So in our case, the COVID-19 stigma reduction project will investigate stigma, fear, discrimination, and misinformation directed against members of Chinese Canadians and other racialized communities in Canada. We will be recruiting groups comprising participants from East Asian community, South Asian community, and African, Caribbean, and Black community in Ontario, Canada. So another important piece of information around the use of this approach is the collective narrative. So the purpose of the sequential focus group is to explore people's perspectives on and their experiences in sufficient depth to allow to build collective narratives. And this is particularly important when you're dealing with racialized communities. So the repeated meetings would ensure that there would be ample time for stories to unfold and to explore more in depth people's experiences. And again, particularly with our study being Stigma during COVID, again, if we compare that with a single focus group session, then clearly there's more success around the use of a sequential focus group in terms of gathering that collective narrative. So sequential focus groups respects a narrative approach that participants could potentially use to articulate their common experiences. So let's look at some of the theoretical perspectives or theories that underlie this particular method. One of the most prominent theories that is really a driving force behind a sequential focus group discussion is a post-colonial theory. And when we're thinking about post-colonial theory or post-colonial perspective, we often think of the founder of post-colonial theory, the scholar and researcher and author, Edward Said, in his seminal work on post-colonialism in his book, in his book that he published in 1978, Orientalism. So Said talks about this powerful framework that sheds light on the unequal relations of power that are the legacy of the colonial past and the neo-colonial present as the context. And we know, of course, we emphasize the neo-colonial because we know that colonialism is really still extending from the past to the present. It's important to pay attention to the conceptualization of today's colonialism as a place of multiple identities, interconnected histories, shifting and diverse material conditions, and a place in which new racism and oppressions are being formed. And again, it revolves around the refocus our attention on contemporary construction of race, ethnicity, and culture, and how they continue to create patterns of inclusion and exclusion within a healthcare setting. And if we look at particularly COVID-19, we know that a group that was very hit really hard in long-term facilities or long-term care is the elderly, but also staff working with the elderly. And if you look at least in Ontario, the Ontario scene, most of the staff that work in long-term care are racialized people, and a lot of them don't have full-time positions. They go from one long-term facility to the next, and as such, they're more vulnerable. They don't have, they have to work in more than one place. That really puts them at risk for COVID. And also, not often they work in very favorable work conditions that really puts them more at risk. And if we look in general at COVID globally, we know that COVID affected more racialized communities, communities that are more vulnerable, and particularly around the issues of access to care that become really important. So the implications of conducting research that's informed by a post-colonial perspective is to provide direction for research in four rather interrelated ways. So the first way is to focus on issues of partnership and voice in the research process. And of course, whenever we think in terms of a partnership or voice, we often think of community-based participatory research. That would be really ideal. The second way is commitment to engaging in praxis-oriented inquiry. And that's very important whenever you're dealing with whether it's indigenous populations or racialized populations or other vulnerable populations. It's very important that the research at the end provides some kind of practical solutions or some kind of benefit to that community. Understanding how continuities from the past shape the present context of health and healthcare. And again, going to the premise of the post-colonial theory, which is really what Edward Said talked about, is the past still informs the present, and we're still very much into a neo-colonial states. And if we look at particularly present settler colonial states, we're fully aware of the impact of the past on the present. And number 4, the consideration that research can have the potential to colonize. And so if we're very aware of that, it's very important, particularly when we're working with racialized and vulnerable communities, to be careful that the research is not kind of furthering decolonization. And as such, it's very important to draw attention to the concept of cultural safety as an instrument for incorporating post-colonial perspectives. And we're hoping we're able to do that by using a sequential focus group discussion method. Analytically, so the overarching analytical model for the sequential focus group method is phenomenology, focusing on the common experiences of racialized people and families affected by COVID. So reflecting on the use of phenomenological narrative interviews as a research method. So phenomenology provides a link with racialized peoples and their culture, as it employs the natural inherent methods of narratives and stories. And a lot of the racialized communities, same like indigenous communities, storytelling and oral ways of sharing those common experiences is very prominent and important. Let's look at applications, possible applications. So this particular method was applied in a study that's very close and near dear to my heart, which is the Yasmina study. So this is the study that I'm actually leading, which is the youth sexual health and HIV STI prevention in Middle Eastern and North African communities in Ontario, Yasmina study. We just finished our data collection and we're almost done also with the data analysis. So our results actually validate the use of the sequential focus group, because that's the approach that we've used as an approach that enables in-depth exploration of complex issues that are often associated with discrimination and stigma. And for us in the Yasmina study, it really engages youth living in Ontario who self-identify as Middle Eastern or North African, and they come from key populations such as men who have sex with men, queer women, transgender women, and heterosexual men and women in a series of 2 sequential critical dialogical focus group sessions. We used sequential focus groups in engaging the vulnerable populations in critical dialogue to challenge hegemonic gendered expectations, racism, homophobia, and sexual stigma. And also the sequential focus group approach helped cultivate a deeper level of engagement and reflection as compared to, for instance, a single session focus group. And very important piece is also a very important kind of application and product is intervention. So we really hope that the second focus group, what we do, or the third, any sequential focus groups would give us more information around what the participants themselves see as potential ways for interventions. And that's very important for us. Let's look at a possible application for this particular method is, of course, in our own study, the COVID-19 Stigma Reduction Project. So we plan to conduct a series of 2 focus groups with the same participants, so 6 to 8 participants in each community, and these would be from the South Asian, East Asian, African, Caribbean, and Black, for a total of 18 focus groups. Again, this is a proposal at this point. We're not at that stage yet for the data collection, so it's a good suggestion. So using an equity and intersectional lens, teams from our focus group discussions would include a thorough discussion of the participants' cultural heritage and acculturation experiences, gender identity and sexual orientation, educational level and support networks, as well as how they have been recently and historically impacted by experiences of racism, exclusion, isolation, violence, verbal abuse, and stigmatization, which predate and include experiences related to the COVID-19 disease epidemic. So we're hoping that our end plan is to engage the members, and hopefully we're able to come up with some kind of intervention. So that leads us to the next slide, which is the input into potential interventions. The significance of the sequential focus group discussion will capture experiences of stigma over time throughout the pandemic and will provide input into potential interventions. And it's always best to capture the voices of the participants themselves and what they see as the best way for intervention. In our study at this point, this is where we're at. We are almost done with wrapping up our scoping review. So, and our scoping review is looking at interventions that work to combat stigma, particularly for racialized communities and for the ones that we've just mentioned. We're also, the data, the results that we're going to get from the scoping review will help us in terms of crafting the questions for the interviews or the focus groups, and we'll use that both information or both data that we're collecting from both sources we'll use so that we're able to pilot some of that intervention. And that's actually the last step in terms of our study, which is finding culturally relevant interventions, and we're able to pilot test them and see if they're able to make a difference in our own communities and the racialized communities we're working with. Okay, so that's the end of my presentation. So this is a look at the references. I'll just pause a couple of seconds to allow you an opportunity to check the references. And thank you all for your interest in our symposium. Thank you for joining us in this virtual platform. This is my contact information, my email address, roula.hawa@universitywesternontario.ca. And you can follow me via Twitter as well. My Twitter handle is @Roula-Hawa. Thank you again. And this is a nice segue to the next part of our symposium with my colleague.
Hi, I'm Abby Goldstein, and I'm an associate professor at the University of Toronto, and I'm presenting today on motivational interviewing, enhancing COVID-19 disease prevention through behavioral science. I often like to start a talk on motivational interviewing by talking a little bit about what change involves. And throughout the pandemic, people have been asked to make a number of different changes. Early on, they were asked to stay home, to stop spending time with friends, and stop engaging in their usual activities. Later on, they were told they could see friends, but at a distance, and to be wearing masks when they were in any situation outside their homes. Now we're focusing on getting people vaccinated and ensuring that they're protected against the virus. In all of these instances, we're talking about a change that is very different from what individuals are accustomed to doing. And it's important to note that change is difficult for most people, that they find it very hard to do things that are different from what they've usually been doing. And then oftentimes change can be hard at the beginning and messy in the middle, but when we see the results of that change, we're much better able to recognize the benefits of it. When thinking about change, it's helpful to apply the stage of change model, or the trans-theoretical model that was proposed by Prochaska and DiClemente. They propose that individuals move through a series of stages before coming to the decision to make a change, and that individuals at various stages require different types of interventions in order to facilitate them making a change. From a public health perspective, we're talking about changes that are in the service of protecting the individual and protecting others. And so we're really looking at the types of change that are intended to benefit the individual and benefit others in society. And so thinking about how we want to work with people in various stages of change provides us with some opportunities to reflect on what's going to be most helpful depending on where a person is at. The stage of change model provides some perspective on helping to match treatment to an individual's level of commitment. For example, providing solutions to somebody who is in the pre-contemplation stage is unlikely to result in much action on their part. It's also given us an opportunity to shift conversations from an exclusive focus on outcomes, such as getting vaccinated, to focusing on motivation. What can we do to help people who aren't quite ready to get vaccinated, but we want to encourage increasing motivation and commitment? Individuals can also be in different stages for different behaviors. People who may have been on board for wearing masks may be reluctant for various reasons to engage in the vaccination process. And they can also change their stages with respect to a behavior over time. So while people may have been willing to utilize masks or engage in social distancing early on in the pandemic, we saw that there was some fatigue as the pandemic was lengthened. And so their stage of change may have changed as a result of the ongoing nature of the pandemic. And progress through these stages is non-linear. People may be in action, as I just mentioned, and then they may go back into pre-contemplation or contemplation. The The nice thing about the stages of change model is that it gives us a sense of what tasks we need to utilize for individuals who may be at different stages of change. So, for example, people in the contemplation stage, those who are weighing the pros and cons of making a change, benefit from strategies that really help them explore those pros and cons in more detail and highlight the ways in which the benefits of change outweigh the sort of consequences or downsides of change. And motivational interviewing is an intervention that is meant to meet people who are within that contemplation stage of change. It's a collaborative, goal-oriented style of communication that pays particular attention to the language of change. And it's designed to strengthen a person's personal motivation for and commitment to a specific goal by eliciting and exploring their own reasons for change within an atmosphere of acceptance and compassion. What's important to keep in mind about motivational interviewing is that it is a communication style. So while it's used as an intervention to facilitate change and to engage people in various health behavior changes, it is really a way of communicating with people about change and a way of facilitating greater focus on change, greater motivation to change, and strengthening commitment to make changes. And although motivational interviewing is essentially atheoretical, it wasn't developed with any particular theory in mind, it aligns well with self-determination theory, which highlights the important role of motivation and values in moving people from being less motivated to being more motivated. Self-determination theory also highlights the ways in which intrinsic motivation is particularly important for helping people to make and sustain changes. When individuals are motivated by external factors, so for example, somebody telling them to do something or because of guilt or shame, oftentimes those changes aren't fully integrated within the individual. And motivational interviewing really highlights the importance of intrinsic motivation, that if we want people to make change and sustain those changes, we need to really understand where that decision and motivation to change lies within them. Motivational interviewing has a well-established profile of efficacy across a range of health-related behaviors. It's been used within the substance use field for many years. It's used in weight management, smoking cessation, mental health treatment engagement. It's also been used in the field of vaccination promotion. So there have been interventions developed to support parents in engaging in vaccinations for their children and has demonstrated efficacy in this area. So it has a lot of applicability and evidence behind it in terms of public health interventions. In some ways, motivational interviewing is really making known what we already know. So there are many aspects of motivational interviewing that really reflect just well-established communication practices that sort of highlight how we can support people in making changes. And it's about using skills in a skillful way. And I think one of the things that arose in the pandemic when we first saw some of the public health messaging that was emerging is that there wasn't necessarily sort of skillful use. There wasn't necessarily attention to the extent to which communication strategies were targeting some of the aspects that we know are important in considering what helps and supports people in making changes. The 4 principles of motivational interviewing are expressing empathy, so trying to understand an individual's perspective and what may be some of their reasons for not changing, as well as what may be some of their reasons to want to change. Developing a discrepancy, so highlighting the ways in which an individual's current behavior may contrast what their values or goals are, and showing some of that ways in which those inconsistencies lie within the individual. Supporting self-efficacy, using affirmations to help individuals feel more confident about making changes. And finally, softening sustained talk. So helping to promote change talk, promote desire, ability, reasons, need, and commitment to change, and softening how often and how much an individual may focus more on the reasons not to change. Motivational interviewing also stands in contrast to some of the well-known roadblocks that have been identified within the communication literature. So these are just a few of the roadblocks that have been outlined, and Thomas Gordon is oftentimes attributed with the discussion of these roadblocks. And these are the things we know don't work for people when they're attempting to make a change. These are the things we know tend to get people to be more embedded within the status quo. So oftentimes when we order people to make change, when we warn them of the consequences of not changing or give advice, provide solutions, when we try to persuade with logic or argue that they should change or give them sort of a moral imperative about change, or when we judge, blame, and shame them for not changing, these are things that get people more entrenched in the status quo. Oftentimes these kinds of communication lead to defensiveness, and they lead to the individual arguing for why they should stay the same rather than helping them consider what could be the benefits of making a change. One example of some of the shaming and blaming that emerged within the context of COVID-19 was the blame that was placed on young adults for not engaging in some of the social distancing and masking that was being mandated at those times. So here are some headlines that came out about sort of how young adults were defying some of the rules and were being reckless and unintelligent, or their boredom was contributing to not complying with social distancing measures. In fact, the research didn't really bear out that young adults were particularly responsible for not engaging in mask wearing or social distancing. Most Americans and most North Americans of every age bracket reported that they were wearing masks and social distancing at least often or all of the time. There was some discussion too about how age differences and threat perception are important to consider in our messaging. So while older Americans were more likely to perceive the pandemic as a major threat to their personal health, younger Americans were more likely to perceive the pandemic as a threat to their personal finances. And that's because younger Americans were more impacted by job loss than older Americans. So they were more likely to be concerned about their jobs, be concerned about their financial circumstances, and experience emotional distress as a result. In Canada, a study was conducted to look at sexual and gender minority individuals. And again, the research contradicted some of the depictions of young adults that were being propagated. What that study found was that over 90% of respondents under the age of 30 reported that they were practicing social distancing and wearing a mask. So there's not a lot of evidence to support young adults as being particularly responsible for non-compliance with public health messaging, and yet this shaming and blaming still made its way to the media and likely had a negative effect on the willingness of some individuals to engage in the public health initiatives. I want to turn to some of the messaging that was on social media about the pandemic and the ways in which it may or may not have aligned with what we know are good communication strategies and are consistent with this motivational interviewing perspective. So early on, the sort of hashtags that emerged on Twitter said things like stay home save lives, wash your hands, together at home. And research showed that these were among the most popular handles or popular hashtags that were being used on Twitter during the early phases of the pandemic. Health Canada had some social media campaigns as well, and some of the directives were about staying home and keeping your distance, wearing a mask and washing your hands, sort of really said in a way that were directions, sort of do these things, you should do these things. And then getting the facts about COVID-19. The vaccines can't give you COVID-19. So giving some information, but without any context around sort of how do we ensure that people are actually going to engage with that message. And what I wanted to raise today was the possibility of using more MI-based messaging when we're thinking about how do we use social media effectively when we're trying to deliver messaging around public health issues. So some MI-based messaging that could express empathy for the struggles that people were going through when these public health initiatives were being brought forward would maybe go a long way. So it's not easy being apart from friends and family. You want life to get back to normal. You're ready to get back to work and school. There's a lot of good information about how vaccines can help stop the spread of COVID-19. It can feel overwhelming sorting through it all. What do you still need to know? Find out more. All of these types of messages are really affirming and empathizing with the struggle that people were experiencing as a result of being asked to do things that they weren't normally doing. These can be add-ons to messaging that is around developing a discrepancy and supporting self-efficacy. So here's sort of the continuation. It's not easy being apart from the people you care about. Your friends and family are important to you. Staying apart now brings us one step closer to being together again in the future. So here we're highlighting the discrepancy between not staying apart and doing something that would be important to that individual, and then providing some information about how they can do that. The second one really sort of, again, getting at people's values, their values and goals around experiencing enjoyable events with family and friends, and the difficulty of not having those things in their lives. So remember what it was like to go to the movies, out for dinner, spend time with friends. We all miss being together. Getting vaccinated protects you and others from the spread of COVID-19 and will get you back to doing the things that are important to you. So here you can see more emphasis on really empathizing with the individual and the struggles, while also providing the information that they need to be able to come to a decision around making a change to their behavior. The truth is, when we submitted this presentation, most of the messaging wasn't necessarily consistent with what we have seen with respect to good communication practices, but there has been change. So this is with more recently from Health Canada. Their social media campaign really does speak to addressing people's values and is more consistent with what we would think of with a motivational interviewing approach. So something like, we can all help bring families together again, get vaccinated. Still that directive at the end, get vaccinated, but that empathy, that value piece is recognized here. We can all help fill the stands with fans again, get vaccinated. So really sort of asking people to join in and to take up the cause together in order to move things forward. A little bit more of a motivational interviewing perspective, in that it targets people's values of wanting to be together with their friends and family and wanting to enjoy events together. Thank you.
Hi, my name is Mariam Mokhberi. I'm presenting on behalf of my supervisor, Dr. Ishtiaq Ahmed from University of Toronto, and the title of our research is Stigma and Prejudice Against Asian Canadians and Asian Americans as Reflected in Twitter Postings. Here is the outline of my presentation, and I start with background information and related work. As you know, there has been a rise of anti-Asian stigma resulted by COVID-19 pandemic in the past couple of years. Incidents of physical and verbal violence against individuals of Asian descent has been reported, and harassment has happened in both online and offline communities. These two charts are from Statistics Canada. As you can see in chart one shows the perceived frequency of harassments or attacks based on race in year 2020. And again, as you can see, the Black population unfortunately still faces the most amount of harassment, followed by Korean, Chinese, and Filipino individuals. However, if you look at the second chart, which shows the increase in harassment and attacks, you can see that Chinese, Korean, and Southeast Asian groups have experienced the most increase in facing these kind of behaviors, which is very concerning and requires the attention of us as researchers. So that was the background motivation of this project for investigating anti-Asian stigma in online communities. But there has also been some related work on the analysis of COVID-related tweets. For example, other researchers have worked on characterizing social media users, mapping geo-distribution of COVID-related tweets, and prediction of the general sentiment in the tweets. However, there's still a gap for addressing anti-Asian stigma and hate speech from a computational perspective, which brings us to this project. So in this line, we have defined these 3 research questions. We would like to know if there is repeating pattern of COVID-related stigma against the Asian population in online communities, and if so, how can we detect and find such stigma in online communities? Finally, we would like to know what are the best technological solutions to help the intervention process. So here's an overview of our journey to answer those research questions. As you can see here, our methods involve several iterations of building a data set, processing the data, and generating results based on that data set, and then again improving the data set based on the results. The first step in investigating the COVID-related anti-Asian tweets was gathering the tweets related to general COVID-19 topics, which are not necessarily on topic of anti-Asian stigma, using the 3 resources, which you can see here. We call this dataset version 0, which contains about 670 million tweets. Next, we extracted 62 potentially stigmatizing hashtags by manually investigating the tweets and looking for co-occurring hashtags. As you can see here, examples of stigmatizing hashtags are Chinese virus, Kung flu, and Wuhan coronavirus. Then having these 62 hashtags in hand, we then crawled the Twitter corpus and downloaded the tweet containing these hashtags, which gave us 220,000 potentially stigmatizing tweets. We've named this dataset version 1. We then sampled an 8,700 subsets of dataset version 1 and manually coded the tweets into one of the 4 categories of stigmatizing, anti-stigmatizing, fact, information, misinformation, and or political. We also ran a topic modeling algorithm, Twitter LDA, on dataset version 1 to find the most prominent discourse around COVID-19 and Asian population. And finally, using the results of the 2 steps which I mentioned above, meaning manual coding and topic modeling, we generated an extensive list of keywords related to COVID-19 and anti-Asian stigma. So here it's worth mentioning that we found that the stigmatizing keywords lie into one of the 2 categories of cultural stigmatization, which talks about wet market and special cultural habits, or political stigmatization, which talks about Chinese government and their response to the pandemic. Based on the list of keywords, we built a score-based criteria to generate an improved dataset of tweets with anti-Asian content. The steps for scoring a tweet is pre-processing both the keywords and the tweets, and counting the number of unique problematic keywords in each tweet, and then assigning a score to each special tweet. So for example, as you can see in the top yellow box, the tweet has a score 0 because it has 6 words overlapping with our extracted keyword. Similarly, the tweet in the bottom yellow box gets score 2 because it has 2 overlapping keywords with our list. Using this criteria, we generated a new improved dataset containing all the tweets with a stigma score more than 0. And we call this dataset version 2. So this dataset version 2, which contains high quality, reliable data related to anti-Asian COVID-related stigma, enables us to make an AI model for automatic detection of anti-Asian stigmatizing language. To build the model, we first pre-processed the data by noise reduction, tokenizing, and lemmatization. Then we extracted 2 different set of features based on traditional machine learning models, meaning TF-IDF features and part of speech tags and LIWC features. In the next step, we fed the features to various classification algorithms that you can see a list of them here. And finally, we generated performance results for all the models. And as you can see in this table, our best performing model, support vector machine with TF-IDF features, is capable of detecting anti-Asian stigmatizing tweets with 99% accuracy. Just for the sake of comparison, it's worth mentioning that the best classifier based on part of the speech tags and LIWC features was backend classifier with about 89% accuracy. In addition to building models based on traditional AI approach, we made an stigma detector algorithm based on deep learning algorithm, which is the state-of-the-art method in language processing. Here, again, we pre-process the data and then use BERT language model to automatically classify anti-Asian stigmatizing language versus neutral language. As you can see here in the table, this model performs with an accuracy higher than 99% on dataset version 2, which is an intrinsic dataset, which is a significant achievement, and also has an accuracy above 89% on an extrinsic dataset, which is again considerable. Here, I would like to summarize our contributions. In this project, we generated a reliable data set around COVID-related anti-Asian stigma, which can be shared with other researchers too, as a seed point for further explorations by them. And more importantly, we created an AI algorithm capable of detecting COVID-related anti-Asian stigmatizing language with an accuracy of about 99% on COVID-related keyword-specific data sets, and an accuracy of above 89% on general COVID-related text datasets. This algorithm can be embedded in any website, software, or application to find anti-Asian stigma. At the end, I would like to mention our next steps. So we are improving the quality of our COVID-related anti-Asian tweet dataset by adding additional labels and text analysis with the help of human crowd workers, which will be dataset version 3. And we're also building a plugin to be installed on web browsers, which is capable of detecting anti-Asian stigmatizing language based on our AI model. It is also helping any author write racism and stigma-free text. That brings us to the end of this presentation. Thank you everyone for your attention. We would be happy to hear your questions and feedbacks. Thank you.
I'm really excited today to be the discussant for social media platforms and stigma, discrimination, and misinformation concerning COVID-19. My name is Carmen Logie, and I'm the Canada Research Chair in Global Health Equity and Social Justice with Marginalized Populations, and an Associate Professor at the Factor and Montage Faculty of Social Work at the University of Toronto. So I'm going to provide a brief summary of our speakers today, and then conclude with an overview of some of the overarching themes. So Dr. Gillis really set the foundation for this study. He described its multifaceted four-stage approach to better understand the stigma, discrimination, and fear surrounding COVID-19 in Canada. He described that he's going to be doing a qualitative analysis of Twitter posts and presented some preliminary findings. He also described qualitative interviews that will be conducted with Chinese, African, Caribbean, Black, and South Asian individuals in Toronto, Canada, as well as a quantitative national survey across Canada to better understand COVID-19 stigma, discrimination, fear, and information. And finally, an intervention that will be developed to reduce COVID-19 stigma and misinformation, as well as address other issues such as vaccine acceptability using social media influencers and web-based motivational interviewing. Next, we heard from Dr. Kteily-Hawa, who described a sequential focus group approach that she is using. This approach uses semi-structured interviews with the same group of persons from a focus group. So participants will complete a focus group, and then they'll be invited to do in-depth interviews. This provides deeper insight into the phenomena. She also described using a theoretical approach that considers partnership and voice, practice-oriented inquiry, the continuity between past and present, the potential impacts of colonization on the research process, and the concept of cultural safety. Next, we heard from Dr. Goldstein. She described motivational interviewing in all of its multiple facets, reminding us that change is hard and messy, but can be worth it, and that people have been asked to change many times during this pandemic, whether it was regarding physical distancing, mask wearing, and now, we're in the situation where motivational interviewing is particularly important when it comes to vaccine acceptability. She also described the stages of change model and how change occurs across various different stages, and the fact that we need skillful communication around multiple facets of COVID-19, including vaccinations. And she reminds us of the motivational interviewing tenets of empathy, developing discrepancy, self-efficacy, and sustaining talk. And finally, we heard from Dr. Ahmed. He describes that anti-Asian stigma since the beginning of the pandemic includes both verbal and physical violence and offline and online violence, and answers the question, how can we look at patterns of COVID-19 stigma towards Asian persons online? How can we detect and fight stigma online? What are the technological solutions? He described a very long journey of how they came to develop an artificial intelligence algorithm to automatically detect anti-Asian stigmatizing attitudes on Twitter. And he also produced a reliable data set on COVID-19 related anti-Asian sentiment, as well as a highly accurate AI algorithm. So taking all of these presentations together, what can we see? We see that this study was multi-method, theoretically informed, and addressed various phases of the COVID-19 continuum. For instance, our learning about its origins and how we first responded to the pandemic, to things such as wearing face masks and physical distancing, to where we are now in Canada with considerations around vaccine acceptability. So all of these have helped us to enhance understanding over the past year and a half of managing COVID-19 in our daily lives. And just to recap, the theories that people brought up in the presentation today included different theories of stigma and how that stigma intersected with pre-existing racism and xenophobia, motivational interviewing theories and principal tenets, as well as post-colonial theory. Methods that were discussed today included qualitative methods such as sequential focus groups, in-depth interviews, quantitative methods such as national surveys, as well as machine learning and innovative approaches to interventions that use social media influencers. And the stigma that was explored was also quite complex. So looking at stigma online over time toward Asian communities on Twitter, as well as offline stigma towards various racialized communities in Toronto, Canada. And finally, we can consider communication. How has the communication that has propagated online stigma impacted the pandemic and the pandemic responses? And on the flip side, how can we leverage strategies that are evidence-based, such as motivational interviewing, to impact the pandemic response in a positive way? Thank you so much for joining us today.